How can an emotional trauma create chronic pain? I'm Dr. Michael Lee, pain performance consultant and a founder here at One Method. Thank you so much for joining me, because I'm hoping that this topic, not only does it has a lot of interest in a lot of people, but also there's a lot of people that will think, oh, it's impossible that an emotional trauma can create bodily trauma. Well, it really comes down to different theories, different philosophies, but also different practices. From my point of view, I'd always say to all clinicians that do not believe anything I say. All I do is just give you my experience. I only can tell you what I know, but ultimately, there's a lot of things I don't know as well. And I'm going to give that just as a quick disclaimer that I don't know everything. And I'm sure that you'll meet lots of people like myself that also do not know everything too, because there isn't anyone that knows everything, of course. But what I am aware of is this. There's a lot of things I don't know. But one thing I do know is that everything that happens in the body happens for a reason. And when trauma happens or pain happens in the body, the brain doesn't create pain for no reason whatsoever. It doesn't create pain because it's got nothing better to do. Also, it's not as if the brain doesn't know what's happening in the body. That's why there is pain. The brain knows exactly what's happening because generally it creates the pain. And the question you think is, how and why would the brain create the pain? And this is where I'm going to start talking about other different philosophies out there. That's just from my understanding how it works, but there are a lot of things out there that I haven't heard of yet. And there'll be other practitioners here that will be thinking, oh yeah, I do this treatment or that theory and it helps people. And that's why I always say to patients, if it helps you, don't stop. Keep doing what serves you well. But ultimately, when I go and teach this one method around the world, I always want to answer the question, why? Why does a patient have chronic pain? That's the first question. And the second question is, why now? Or why did it start at a certain time? And how do we get rid of it? Those are the main questions I'm always asking. Because remember, at some point in your life, and this happens to every single person in their journey, at some point in your life, everything worked perfectly. And then usually something happens, and usually it's a big trauma, and then things start to break down one thing after another. Just think about it. How many times, as a clinician, how many times you see a patient that you kind of, oh, so you got shoulder pain, you got knee pain, you got hip pain, you got back pain, you got neck pain, you got whole body pain. So what was your trauma? And they say, I didn't have one. Did you fall? Nope. Did you have a car accident? Nope. Did you twist your knee? Did you do something? No. And then we write in our notes the word insidious onset, which means nothing, by the way. It means no reason for pain. But actually, there's always a reason. The real question, why? And if you're one of those that you're always chasing, and as soon as you find that patient says, oh, there's no reason, it should be raising a lot of, we call it yellow flags, a lot of question marks. Why has this happened? It has to be a compensation. Because remember, like for example, knee pain is a compensation, hip pain is a compensation, shoulder pain is a compensation, jaw pain is a compensation, headaches is a compensation, right? Unless they've had a physical trauma, a physical incident that caused structural damage to that area, the cause cannot be structure, right? Because it never happened. It has to be either a compensation or they're crazy. But then again, how many times do you want to call a patient crazy? Because they're not crazy. They wouldn't, particularly if you're in private practice, they wouldn't go and pay you money just for you to tell you that they're crazy. But they want you to find the cause. And all you do is find out what is the worst pain they've had, whether it's physical or emotional. And that's what we're going to be talking about today. Because sometimes, let me ask you, generally those who are emotional people, how many times would you agree that sometimes an emotional pain is worse than a physical pain? Because at least a physical pain, when it happens, it stops and then improves. But emotional pains can drag on for a very, very, very long time. And that's why a lot of people find emotional pains worse. And when they are emotional traumas, rather, when there's emotional trauma, well, it's still a pain. There's a part of the brain we call the basal ganglia. The basal ganglia remembers absolutely every single trauma you've had in your life, whether it's physical or emotional. And because you've experienced it, guess what the brain's number one priority is? Survival. So what is it going to do? Quite simply, it's going to create protective mechanisms. And what are those protective mechanisms? It's going to cause compensations in the body. Just think about it. A compensation, very simple, is when someone's stressed, what happens? Shoulders go up. Yeah. Are they consciously lifting their shoulders up? No. It's a subconscious response. It's a subconscious response to what? Stress. Because they've had that stress before. So the brain protects itself by doing this. Next thing, for example, if they have back pain, right? They might have back pain. The question is, what's created the back pain? Right? They haven't fallen. And it's usually the most silliest things as well. It's like twisting in bed, brushing your teeth over a sink. Why do you get back pain? Because you have over 100 muscles in your lower back anyway. How come every single one of them switched off? The question is why? Why is that there's that response? Something triggers the brain to respond in that way. The real question is, what is the trigger? But a lot of people don't realize that actually it could be an emotional trigger. We have many tests to find out what the trigger is. Also, we have many tests to find out what is the main trigger that's causing this pain in that patient. Because our job here is to find out the root cause. As soon as we find out the root cause, not only do we get rid of the pain, we also stop them coming back. Because we get rid of, I call it, a faulty protective mechanism. The protective mechanism is there to protect the person if that trauma happened again. The chances of it happening again are next to zero. A lot of you know my story, for example, when I was in a wheelchair for over 2 years. That, yeah, my brain was protecting me from the surgery. What are the chances of me having another surgery? Zero. But the protective mechanism was there because I had the trauma. And as soon as I got rid of that protective mechanism, it was faulty, then actually there was no pain. I got rid of the pain in 5 minutes. Although I had to study a lot to figure it out. Yes, it took me a long time to figure it out. But it's also the same principles that we apply to emotion. Because if you had an emotional trauma, and it might be the worst one you've ever had in your life, your worst pain your entire life, simple question, would you like to experience it again? Most people, if not everyone, will say no thanks, because it was so bad the first time, and it'll be so bad if it happened another time. And that's why those protective mechanisms are in place. But the chances of it happening again are very slim, if not zero. And that's why the brain creates these protective mechanisms just in case. So this is why we need to find out the root cause. But the thing is that although emotion is quite a very broad word, there's lots of different emotions that can happen there. It can be fear, it can be anxiety, it can be stress, it could be depression, it could be loss, it could be bereavement, it could be loneliness, right? It could be helplessness, it could be being out of control. All these different triggers can cause that. As soon as they think it, and you guys can do a simple test. Just think of something that is negative to you, where you're afraid of something or something you don't like, and just test the muscle. It'll go weak. Just do a strength test. It'll go weak. It's just a natural response to your traumas. But if you find this actually very interesting, because how we actually tie everything in together in the one method, the reason why it's called one method, because this is probably the only method you need to actually get rid of chronic pain for good, is that we find the root cause and we've actually accumulated all the knowledge. Well, we've completed over 7 degrees and found out actually this is the 20% that actually works. So these are 80% only treat symptoms. That's why I get rid of it. This is the 20% that really, really gets to the root cause and finds out why the brain creates so much dysfunction in our bodies. And that's why I get fibromyalgia. That's why people have chronic fatigue. That's why people have long COVID. That's why people have got pain in their joints, headaches, migraines, seizures. Why does it happen? It's all because the brain creates it. And the thing is, emotion can actually sit in a lot of this. Also in terms of diseases too. Cancers, diabetes, right? All these different things. Irritable bowel. There's a reason why it happened at a specific time in that person's life. And if you want to find out more information, of course, we are teaching a fundamentals course shortly later this year. If you're interested in it, to find out and really help patients in terms of finding a root cause and how we test it, how we assess it, and then how we treat it, what will really surprise you is this. The treatment can be as short as 5 minutes, and it will change their lives forever. The assessment may take a little bit longer, maybe 10 minutes, but as soon as you find the root cause, not only can you get rid of the pain, you can stop it from coming back. So I hope you found this live very helpful for you, whether you're watching on Facebook, Instagram, or even YouTube, or or Twitter. But put in the comments if you have any questions. But if you're interested in actually joining us on one of our courses, put me in a chat, and I'll be more than happy to get one of our advisors to contact you in terms of if this is a good fit for you. But I'd say it's for advanced practitioners. It's for advanced practitioners who are wanting to be experts, not just experts in their community, not just in the city, not in the country, but actually world-class experts, because these are the people that get the results quickly and permanently. So thank you so much for watching, and I look forward to seeing you next Tuesday for the One Method. Have a great day. Bye for now.